My name is Julie Reynolds, and now I'm going to go over our anesthesia form. On here we have the patient's name or last name, the owner's name, the date, the breed of the pet, the sex, the age, and the weight, and we write it in pounds and kilograms, and then the procedure that's to be done. We have room for the TPR, and usually we just write that in the file, so we'll put a note C file, or we'll comment on any abnormalities. We have the different options for pre-anesthetic drugs listed on our forms. We have atropine, acepromazine, morphine, buprenorphine, Valium, and we also have a spot where we can put other. And next to those, we determine which drug is best for that patient along with the doctor, and we calculate out the dosage, and we put the milliliters that we'll be administering and also how many milligrams of the drug. So for example, this patient as a pre-anesthetic received 16.5 milligrams of morphine and 1.1 that was in 1.1 milliliters. So our pre-medication and then our induction agents, and our maintenance for general anesthesia. So we have ketamine, Valium, propofol, isoflurane, and sevoflurane. We select which ones we plan to use and the amount that we plan to deliver to the patient. So with ketamine, Valium, I plan to deliver 3.6 milliliters. If there's any change from what's actually written down to what was administered, we make sure to change our records. We select our system that we're going to use. So here we're going to use intubation with a circle system since the pet's over the 15 pounds or 20 pounds. And then we do calculate for IV fluid therapy. We write down which catheter we're going to use, then we write down the location that we're placing the catheter or where it was placed, and the fluid rate we plan to use. And then also what fluids we're going to use. We could use lactated ringers or sodium chloride or other. We have post-operative pain control and the dosage. The antibiotics that are given during surgery. So basically this form has our most commonly used drugs. And then the duration of anesthesia. So we write the time that we give the pre-med, the time that we induce the pet, and the time the surgery was completed. And then we have a spot here for any other drugs given during surgery. This pet was given diphenhydramine, and we put the route, so 72.5 milligrams IV. We have a laser at our work, and so if we're lasering the incision site, we will check that and the condition at the end of the procedure. So good, fair, poor, euthanasia, or expired. Then we also have room for our anesthetic monitoring, and I go over that in a later part of the video. And then we have room for the doctor to write up the surgery description and post-operative medications that the doctor has selected for the pet. So that's our basic anesthesia form, and we monitor the pet while it's under anesthesia and write down vitals, heart rate, SpO2, the amount of isoflurane we're delivering, the mean arterial pressure, the CRT, mucous membrane, respiratory rate, and positive pressure ventilation when we do that. So here we have it at 10-minute intervals, but we can also write in next to it, what time. So that is our anesthesia form.